AFC Malaysia. Good morning. What is the stem cells? Okay, they can able to sell in the world, such as duplicating, which we are known as stem cells in water. And for the stem cells in water, they able to differentiation into the specializing cells, that is specialized cells in various organs. And able to limited duplications. Once they have converted into specialized cells, they are able to program to die. And during the blastocyst stage, after the sperm unite with the ovule on the 5th of 6 days in the uterus, and we are getting these full cells, which is known as blastocysts. And blastocysts, inside the blastocysts, we have the stem cells, which we know as the pluripotent stem cells. Pluripotent stem cells able to become the entire humans. Yeah. Outside the membrane of the blastocyst will form the cord and the placenta. And as we know, with age, the stem cells numbers go down, and stem cells lose their functionality too. During baby stage, the stem cells functionality is about 100%. So during the age by 18 years, it is about 40%. By the age of 30, it is 25%. And at the age of 60 plus, the functionality of the stem cells just leave about 5%. So this is a stem cells regeneration cycle that during the baby stage, in every 10,000 of the body cells, we only have one stem cells for the repair of the damaged cells. During the teenage time, for every 100,000 body cells, we only leave about one stem cells in the body for repairing the damaged cells. During the adult stage, for 250,000 body cells, we have only one stem cells to duplicate for repairing of the stem cells. During the elderly stage, such as 60 over, 70 over, for every 2 billion cells, we only have only one stem cells to repair. In other words, the older we are getting, we have a declining of the stem cells number in the body, but so we are unable to repair much of the cells damaged, and the organ ultimately will lose their function. It's not true. And for stem cells, usually exogenous stem cells, what I mean for the stem cells properly, usually we harvest it from the patients or from the donor, and we administer by a trained professional, and we need a sterile procedure and environment during the culturing, harvesting, and transmission. And the concerns are stem cells therapy is very, very expensive, and of course, the most important concern will be risk of infection. And in Malaysia, roughly nowadays, stem cell transfusion, stem cells treatment is about from 60,000 ringgit and up to maybe more than 100,000 ringgit. And we found out the most effective way to treat alternative pathway to get the stem cell is to replenish the stem cells in our body so that we can activate our own natural process of producing more stem cells for repairing for the damaged cells. As we know that peptide has been known for more than 100 years, more than 18 scientists, so they have discovered different types of peptides, and most of them, they have got the Nobel Prizes. And the four main functions of peptides such as hormone balancing, stimulate own body to regenerate stem cells, collagen regenerations, and as a messenger for the cell's linkage. And those the peptides able to activate our citrins. So it's one citrins. Citrins are the group of a family group of proteins visually present in all organisms, and they are very famous for in regulating the metabolisms, aging, and for the stress responses. And for sure, citrins activity they need NAD plus dependent enzymes. In other words, the activity they need the NAD plus for them to perform. And citrins activity is linked mainly on the metabolic control, apoptosis, cell survival, development, inflammation, and healthy aging. And the major functions like they are for DNA repair, so they're able to help maintain our genomic stability, and of course during stress time. And second, they are able to regulate our metabolisms such as they influence the fat metabolisms. And the other function is they control the inflammatory pathways, and of course the well-known one, they are for aging and longevity. In organisms such as yeast, worms, if we increase the activity of citrins, we can see that their life expansion will be there, but in real humans, the evidence is mixed. And now I'm going to talk about alternative way to have stimulate our own body to produce more stem cells in order to repair our damaged cells by the free radicals inside the body. So first of all, we have three products which are very, very significant evidence. First is SOP Subarashi, second is Utsukushhii, third is Hikari. SOP Subarashi is a breakthrough, and it is the triple peptides. And the main ingredients over here in the SOP Subarashi will be the salmon ovary peptide number 1, number 2 is the sardine peptides, and number 3 is the tomato peptides. Besides, they have some active ingredients, most of them they are highly antioxidants and anti-inflammatory. And for SOP Subarashi, it has undergone various clinical studies, and they have 4 patents at the moment. First patent, as we can see, is a cell regeneration effect. Cell regeneration effect, that means it means that when our body cells which are damaged by the free radicals inside our body, SOP Subarashi able to help our body to regenerate for the damaged cells, replace for the damaged cells. And second will be improve the blood circulation, as we know that once you have improved, you have regenerated the new cells for the damaged cells, those areas of the new cells or the organs, we need circulation to reach the area, because those are new cells, they need nutrients to survive. So in other words, the second patent will be increased blood circulation for the survival of the newly formed cells. Third will be the antihypertensive. Antihypertensive is per se is not for just for those people with hypertension. In this context, as we say, cell regeneration effect, improve blood circulation. If we need to improve the blood circulation, we need to maintain the blood pressure within the blood versus the endothelial pressure. So over here, we can see that the cell antihypertensive in these patents is not solely for people with hypertension. It's mainly for the survival of the newly formed cells, in order that the blood circulation will reach that area to supply the nutrients to the newly formed cells. And fourth, quite important, is preventing the blood clotting. In this context, preventing blood clotting for general use, they are very good to reduce the risk of cardiovascular diseases, sudden strokes. And over here, for scientific aspect way, the preventing of the blood clot within the blood vessels over there, it to have increased the blood circulation, there will not be any blockage in the microcirculations over there. Those are some of the functions of the SOP Subarashi will help for heart, blood vessels, brain, pancreas, kidney, bones, joints, and hair. Second product that you can see over here, and most of you have to know, is known as Utsukushhii. Utsukushhii, the main ingredients, they are from the three common probiotics, which are such as Bifidobacterium longum, Lactococcus lactis, and Lactobacillus acidophilus. Besides this, of course, they contain other very high antioxidant extracts. For Utsukushhii, of course, they are able to help in our corals, liver, skins. And for Utsukushhii, we have undergone through the strict clinical studies, and we have 8 patents on these products. Patents, to say patents number 1, look at this, the immunoactivity effect. Immunoactivity effect during the clinical study, it found out that it's able to increase our natural body, natural killer cells, NK cells. As we know that NK cells, they're only attacking microbia such as virus, bacteria, fungus, and they're able to attack those cancer cells. And for healthy cells, they are unable to attack because healthy cells has a special mechanism will cut off when NK cells, when you attack the healthy cells, when the molecule, they are attaching time, our healthy cell, they have a special mechanism, they can able to cut the attachment. Second, as we know that it increases the NK cells, it is able to attack the cancer cells, so the second patent for Utsukushhii is an anti-tumor agent. Thirdly, it is also able to suppress the tumor growth and reduce the side effect of anti-cancer drugs. Since it is increased the NK cells able to attack the virus in our body, and the fourth patent will be that it is a therapeutic agent for hepatitis C. As we know that hepatitis C is very, very dangerous, and it will cause the liver cirrhosis, and ultimately it will cause into the liver cancer. And fifth will be it is able to prevent, treat, and cure the respiratory infection, which we have known SARS infection about 25 years ago. And of course, it's also the infection protective agent. As we know, NK cells just attack virus, bacteria, fungus. And the seventh, it has a function of protection against the toxicity of reactive oxygen species. Reactive oxygen species comes from when our body free radicals oxidize our normal cells, and it will damage the normal cells, and those cells, they are known as reactive oxygen species, ROS in the short form. And ROS are very toxic to other cells in our body. In fact, they can damage our DNA, it can damage our mitochondria too. So the patent is a toxic reducer, which everyone needs to take Utsukushhii to detox, auto-detox in our body, because our body full of all the harmful chemicals inside. Third, we have another product known as Hikari. Hikari mainly is a vegan peptides from the 3 kinds of peptides. One is a marigold peptide, second is a spearmint peptide, and the third is a mango leaf peptide. Of course, it has a very, very powerful antioxidant ingredients besides 3 peptides. They have all the 10 berries inside for performing anti-inflammatory functions. As you can see over here, for these triple peptides over here, they are rich in antioxidants, anti-inflammatory, they're able to have antimicrobial, antifungal, and they're able to help the cardiovascular health, blood sugar regulations, eye health, and such as other like oral health and hair health. In Hikari, we have 5 patents and 2 patents for the eyes and 3 patents for the brain. For the eyes, it able to improve the visual performance. And the second patent for the eyes to protect the retina from the blue light and the UV light. And for the brain, they have 3 patents. One is enhance the memory, second is improve the brain activities and alertness. The third one is to increase the rate of the neurogenesis, that means the brain cells. So for Hikari, all diseases, all problem issues related to the brain and the eyes, we think about Hikari. For the brain side, it is very good for the neurodegenerative diseases such as Alzheimer's, Parkinson's, dementia. And it's very good for the stroke patient, and it's very good psychologically. It's very good for those having anxiety disorder, depression, and for those, of course, the most common type is insomnia, unable to fall asleep, or the sleep is not so good. For children, it's very good for autism, ADHD, and for the children, those they are having the problem of the speech delay. And for general populations, for hearing problems, Hikari will able to help. For the eyes issues, such as able to help in cataracts, macular degenerations, glaucoma, dry eyes, pimple, myopia, presbyopia, colorblind, even with floaters over there, and even one I have experience of a retina detachment. So for consumptions, usually we advise we are put under the times because all the molecule size of SOP Subarashi, Utsukushhii, and Hikari, they are very, very small. For Hikari, it's only 500 deltas, SOP Subarashi is 600 deltas, and Utsukushhii is 800 deltas. Once we put under the time, because over here is full of microcirculation, and the absorption in the circulations is very, very fast, and it able to bypass our stomach absorptions. Arigato gozaimasu.